Welcome to Kidney Conversations with ReMend, a webinar designed for patients by patients, and where we have open discussions about kidney care. I'm Kiku Boyance, Executive Director for ReMend, a nonprofit organization dedicated to assisting people with kidney disease. We're a group of everyday people who have either already successfully experienced dialysis, presently undergoing dialysis, or have received a transplant. ReMend provides peer-to-peer mentorship, guidance, and emotional support. Our goal is to encourage and empower those people who are on their kidney journey. Learn more about ReMend by visiting our website at remend.org. We're talking about peritoneal dialysis today, otherwise known as PD. Some of the things we're going to cover today is how does PD actually work, and some of the advantages and disadvantages of PD. But first, we have some quick housekeeping items. We want to hear from you. So please send us your questions in the chat box. You can type in there just to say hello, let us know how you're doing, where you're watching us from. We'll answer questions throughout the broadcast and at the end if we've missed any. So make sure you get in that chat box. We also have a short survey that you can complete anonymously, which we appreciate kindly. That'll pop up at the end of the webinar. So, okay, let's begin. I want to let you know about the fabulous people that we have today. Our panelists include Charmaine Griffith, she's a ReMend mentor. Cindy Polis, she's a care coordination management education nurse with Balboa United. And Dr. Joseph Hebreo, he's a nephrologist with Balboa Nephrology. And Randy Fleet, he is a ReMend mentor also. Welcome, everyone. Thank you, guys. You can turn on your cameras and stuff now. Hi, everyone.
Everyone.
Here's me. Forget telling you guys to turn it on. I turned my own on. Thank you so much for being here, everybody. Let's do, I've got a couple of questions just to get to know everyone a little bit here. So a big welcome to you and a couple of questions. So Charmaine and Randy, let's see, I didn't go over what you guys do, unless you want to do that and say, Charmaine, your previous hemodialysis and PD patient, also two-time transplant recipient. And then Randy, previous PD patient, living donor transplant recipient. I wondered if the two of you might be able to share a little bit about why you chose PD as your dialysis treatment and what was it like for you? So Randy, would you like to start?
Sure, no, I'll start. I got diagnosed with kidney failure in 2009, and I was faced with the challenge of what kind of dialysis to use, either hemodialysis or peritoneal dialysis. Because this was an emergency, I had to start with hemodialysis, where I already got this experience what that was like. But then as I learned more about peritoneal dialysis, that I wanted to go that route, and two reasons in particular. One, it allowed me to be more active and flexible with my schedule, and number two, it was healthier for me because I knew when I was doing hemodialysis, basically the way I looked at it is my body was being filtered 3 times a week for 3 hours a day. So the remaining time, my body was building up toxins and fluids. Whereas with peritoneal dialysis, my body's constantly filtering, allowing me to be more stable. But that in itself was enough just to be more healthy. So to me, it was a really simple answer to that question.
Great, awesome. Thank you. Thank you so much. Ms. Charmaine, why did you choose PD as your dialysis treatment?
I just think, I would have to mirror Randy's reasons. Just that I, after doing the research on it and, becoming educated on the differences, I just felt that, I struggled a lot with in-center just because of the restrictions of diet and fluid. And, I was pretty active way back in the day, not so much anymore, but way back then, I was, it's 20 something years ago. And so I was really active, and it was just really hard to get out of that programming of, only, you have to drink so much water every day. And on hemo, you just really couldn't do that. It was very, very restrictive. But then when I learned about how it worked more like my natural kidney, is what really kind of sold me that, I just felt like it was better for my body. It was more gentle, the way that the process was. And I mean, if I can sleep and do my treatment, I mean, why not? You know, it's kind of a win-win. So, but like Randy too, it was just for traveling purpose. I mean, it's just so many benefits of it. So I like to travel, and so that helped me to be able to have that freedom to do that.
Right. I'm right there with you guys. I also was on PD and it allowed me a lot of freedom. So I'm right there with you guys. I do thank you guys both for sharing that. Cindy, much of your work is focused on educating patients on their treatment options. In your experience, what is the biggest misconception patients have about PD, peritoneal dialysis?
I would have to say as infection, and I think there's a lot of data out there to support PD, and I think people have the time to review how to prevent infection. I think people just need to advocate a little bit for themselves and kind of do their due diligence also, and also speak to educators. But I think there's a misconception on infection with PD, and there's always the good and the bad. So make sure you do your due diligence and read all of it, not just part of it.
Right. Thank you. Dr. Hebreo, I have some questions for you as well. How long have you been a nephrologist, and what was the deciding factor in choosing nephrology as your specialty?
Well, good evening, everyone, and thank you for having me. I've been a nephrologist now for 11 years. Been practicing here in San Diego for that long. I started my career in the military where I trained to become a nephrologist, and I've been in private practice for almost 9 years. And so the reason why I became a nephrologist, I really decided back in my internal medicine residency. I was at that point undecided. I knew I wanted to be a subspecialist within internal medicine, and nephrology spoke to me in large part because of it being a more academic field, an intellectual field, a thinking man's field. It really spoke to me in that sense because I really like to think about medical problems and do my detective work, so to speak, and try to help patients in that way. And the biggest reason was when I saw doctors that were training me, my attendings, they really developed these long-standing relationships with their patients, and it really was something I wanted to do and to be able to help patients for many years and to establish that relationship. And so that was the reason I decided to become a nephrologist.
That's something probably a lot of people don't think about, that, it's a longstanding relationship that you're going to have with patients. So it's really cool to hear you say that, that's one of the main reasons why you went into this field. So thank you for that. And what are some of the biggest changes that you've noticed in kidney care since you've been a physician?
Yeah, I think the biggest change that I'm seeing is actually a push to have patients go on to home dialysis and home modalities. Over the past several years, we've seen, from a policy standpoint, where the federal government has issued a mandate to try to get patients to be on home dialysis. And so I think that's changed over the years. I remember when I was in fellowship training to become a nephrologist, I think I managed 2 patients in my 2 years of training. And I've been fortunate to now see firsthand with Balboa Nephrology how we are, as an organization and group, trying to get patients home and seeing where, at least in my immediate sphere, we're seeing 20% to 30% of patients going on to home therapy, and we're hoping to increase that number as the years go by.
I recommend it. I had a great experience on PD, but I'm sure we'll get into all of that. So let's get started into, our topic here. What are the basics, Dr. Hebreo? What are the basics of PD, peritoneal dialysis? Can you go over a little bit about that?
Yeah, so peritoneal dialysis, dialysis in general, as I'm sure all is a procedure by which the body or our blood is cleaned or filtered of its toxins. And how peritoneal dialysis works is a catheter has to be surgically placed in the abdomen, and once that's placed, we can have what we call a dialysis fluid instilled through that catheter to allow it to mix with the blood in the peritoneum, and the blood is filtered, and then the fluid is then drained out of the body, and it's done in several ways, 2 ways specifically, which I know we're going to get into, but that's how the basics of how peritoneal dialysis work.
Right. Okay. So let's talk about the cycler first, and I'll put up the benefits of using the continuous cycler, which is a machine that we use, and you'll see a photo and everything of that. So here are some of the benefits of continuous cycling peritoneal dialysis. So you can continue with your daily routine. You don't need a partner to help. You dialyze while you sleep, as Charmaine said, and there are fewer fluid and diet restrictions. That's a big topic with many people I speak with about dialysis. No needles, and you can switch to CAPD, which is the manual version of this, which we'll talk about in a minute, when you're traveling. And I think that's huge, because that's another big topic that people want to talk about. They think, well, now I have to go on dialysis and I can't travel anymore. Not true, right, Dr. Hebreo?
No, it's not. That is one of the biggest advantages, in my opinion, for peritoneal dialysis and PD patients. I had a patient just a couple of days ago who I saw in clinic, who was planning a trip to the Philippines, and we were going through the logistics of how he would perform his peritoneal dialysis, both during travel and then once he arrived over there. And so I think it's certainly patients are more than capable to be able to travel and do PD.
It's so good to hear. I also wanted to show a picture of, give people an idea of what this machine, the cycler, looks like. Here it is. It's much more advanced than when I was on dialysis about almost 25 years ago, and it did not look like that. This looks very user-friendly. What do you think, Charmaine?
Yeah, I think it's definitely different. Like you, it was the same, like about 25 years ago is when I, yeah, it's very high tech, but yet also very user-friendly. There wasn't really much guide. It was just like a little data stream across like a little display.
Yeah.
They kind of told you what to do and stuff like that. So
Right.
yeah, I really like this a lot. The size looks a little bit smaller as well.
It is.
Mine looked like it seemed like it was much longer. So but probably about the same height. But yeah, I really like that a lot.
Yeah, me too. Here's another slide about what are some of the cons of the cycler. A machine is needed, as I showed you. Not too bad. You can put it at the side of your bed. Maybe awkward during the night by the machine's noises. I wasn't bothered by that. Were you guys? Were you, Charmaine?
No. Mm-mm.
You may have a catheter in your tummy. I'll show you a little picture of that. And then everything must be clean during the exchange. I mean, any dialysis treatment you have, everything has to be clean. Increased risk of infection, either in the peritoneal cavity or at the site of your catheter. That can happen on any version, any modality of dialysis. You always have to be very careful. And then storage of supplies. And I wanted to show you this because a lot of people mention this too. Some things that people might not think about, but Cindy, this is what, 2 weeks, right? 2 weeks worth of solution. So I took the doors off my closet and put it in there, and so it was
the garage.
Access. Yeah, put it in the garage. Some people, you may have a small place, put it in the corner of your, your living room, whatever is, it allows you just so much flexibility in your lifestyle. So I encourage people, it's not bad. And then here's what a setup might look like in someone's home, with the bags and the machine. And then we're going to talk about this. Would you like to talk about the manual version? Oh, go ahead.
I just wanted to add that it's that the pictures may look a little daunting for those who haven't, started, just all the supplies and things like that. And I just wanted to add that it's kind of like a baby, if you will. Like it just kind of fits into your life, into your, once you get into your routine of doing things, It's just like anything else. It becomes like kind of second nature. But like anything new, it can be a little bit daunting, a little bit overwhelming. And I would just, advise people just to remember that it gets easier because you become more familiar with the process.
Randy, did you do the cycler or manual? I can't remember.
I did the cycler, so same
Yeah.
thing. I did it at nights, and another thing that I definitely want to emphasize, and this is how I looked at it as well. May take up a little bit of space, but you know what? That thing kept me alive and it kept me healthy while I had kidney failure.
And it kept you at
So-
home, right?
Exactly. I didn't have to spend time in a clinic. I could do it at night while I'm sleeping. It was a win-win situation, even though I had supplies and I had to do a little bit more work myself.
Yeah. And the
Yeah, you just
whole
have to kind of
thing,
weigh out the benefits and things too.
right.
Sorry, my
Absolutely.
dog Nathan's trying to chime in. Sorry about that.
I did have one issue that I just wanted to mention that, I didn't care for the cycler myself because I always felt a pinching at, once the fluid had been drained out, I felt like a pinching. And I guess, I don't know if I had the settings incorrect, but I just felt like the manual version, which, I'm going to show you some benefits of that. I think that one was just better for my lifestyle. And so, there's a choice. If you don't like that version, you can go to the other version.
Right.
So you're
Yeah,
not,
that's the great thing about it.
yeah. So I want to just go over the benefits of doing manual peritoneal dialysis. You have greater lifestyle flexibility and independence, especially if you're working, you want to travel, you live far from the hemodialysis center, you can do peritoneal dialysis at home without assistance. It's a less restricted diet, which is huge for me, at least. So that's something to consider. Peritoneal dialysis is done more continuously than hemodialysis, resulting in less accumulation of potassium, sodium, and fluid. And if you watched any of our previous broadcasts, we go into detail about potassium and sodium. And I believe actually May 1st is Potassium Day. So we'll probably post some stuff about that on our social media. This allows you to have more flexible diet than you could have on hemo. No needles used during this treatment. You won't have to travel to and from the dialysis center, and you can do peritoneal dialysis at home without assistance. I did mine in my office, was making sure it was a sterile environment. And here's a picture of someone just casually doing her dialysis. So, does anyone want to talk about that? Charmaine? Oh, you're muted. I can't hear you.
Yeah. So I just wanted to add that a couple of things is that, when we talked about infection, and people hear all the chitter chatter in the clinic, about infection and, peritoneal and, just remember that everybody's situation is different. There might be somebody that went to peritoneal and then came back to the clinic and like, oh my God, there's so many infections, but, you don't really know their situation. So, and honestly, like infection is just a part of life. You can get an infection from we're in the middle of a pandemic, so, so it's just, I don't know. So I just think that it's just really important to kind of talk to your doctor more about that instead of like listening to people's, like their horrible experience. It's just like kind of get the pros and cons of the whole situation. But anyway, so the catheter, I had the catheter, I would say installed, but installed like really low, right? It was like really low. And so, I was married at the time and my husband and I, we just kind of had some fun with it. And, we named it Captain Winky and, named the machine like Little Buddy. And so it's like when we would go to like the racetrack and like, oh, don't forget Little Buddy, kind of thing. And, we just pack everything up or pack the supplies up in the car. If I was going to do manual, I'd always take, supplies with me in case like we want to do something spontaneous,
Right.
if we wanted to just go on a day trip somewhere, but then we're like, oh, let's stay the night here or something, you have the option to do that. But yeah, so I think that, that's just kind of the way that we dealt with it instead of like, oh my God, I have a catheter. Like I went to the beach, like I wore a bathing suit, like, it's just like Brandy said, like, this is life sustaining for me. So I didn't really care.
Right.
Like, I didn't care what anybody thought about it, including my husband. And so, to me, like, I just made the most of it. And so, like giving it a name is just, it's just kind of fun because it's, if you're cuddling or whatever, up on the couch watching TV at night, it's like, oh, watch Captain Winky, don't lay on him or whatever, so I don't know, that's just kind of how we dealt with it.
Right.
But just the most important thing is that it kept me alive. So that was the main thing.
Dr. Hebreo, I have a question for you from Steven. He says, I carry a lot of weight in the belly. Does that restrict me from having enough belly room to do PD?
Well, thank you for the question. And no, there isn't really any restrictions that if you do carry more weight. The only thing that would need to be considered from a surgical standpoint is really having the surgeon place the catheter in a area that would allow for PD to be done successfully. But as far as carrying any extra weight, there wouldn't be any restrictions to be able to carry any fluid or be able to not do peritoneal dialysis.
Thank you, Dr. Hebreo. I do have some of the cons that we were briefly discussing about the manual PD. Treatments are every 4 to 6 hours every day. Your abdomen is always full of fluid, which may increase the size of your belly. I like to say tummy, but belly. You have a catheter in your abdomen. Everything must be very clean during the exchange. Increased risk of infection either in the peritoneal cavity or at the side of your catheter. Sounds familiar to the other one. And storage of supplies. Here is a photo of what it looks like. So we have our eunuch here who, this is the catheter, and that shows on the outside, but this is inside the body. I don't know if you can tell that, just to give you an idea of what it looks like. It looks crazy, I know, in the beginning, but trust me, like Charmaine was saying, you get used to that, and you learn how to deal with it, like Captain Winky. I had taped mine up and had one of those soft cotton belts that I wore, and I was able to wear bathing suits and whatever. I didn't feel restricted by that. So at first you do, because it's new, it's a change of lifestyle, but you'll figure it out, whatever works for you. So I hope that's not a deterrent for people. Dr. Hebreo, who might be a good candidate for this type of dialysis?
When I ask that question, or when patients ask me that question, I ask, well, who is not who's not a good candidate for peritoneal dialysis? I try to find reasons where there can't be reasons or there are contraindications to not being able to do it. And in my experience, I find that there's not too many of those. Some big ones, just to point it out, is if somebody has had a lot of abdominal surgeries and they have some scarring in there, it might make the procedure of peritoneal dialysis difficult. But beyond that, most patients can be able to do it if they can learn and still have their ability to see and use their hands. They can do peritoneal dialysis, and there's very few patients, in my opinion, who are not candidates for peritoneal dialysis. And even in that situation where patients may not be able to do it themselves, if they're fortunate to have a family member or someone who lives with them to assist them, I have few patients that their family members are helpful to do that, and they can be candidates for PD at home.
So Randy, I wanted to ask you really quick. Charmaine and I talked about how we worked it into our life. So I wanted you to talk about your experience, because I want you to talk about not only how you chose PD and how it was for you, but I want to talk about after you had your transplant. So can you I know that's kind of a lot, but can you get into that for me?
Absolutely. Yeah, so I got diagnosed with kidney failure in March of 2009, and I started peritoneal dialysis, I believe, in April and May of that same year. And that lasted through November 2009 when I finally received I don't want to say finally, because I'm very grateful. I received a kidney transplant from my brother, a living donor. So as of now, I'm going on 12 and a half years since my transplant, and I can't speak enough to how grateful I am for this second chance in life that I feel like I'm really taking the best advantage of. I've never been a runner, but since my transplant, I decided I wanted to at least run one marathon with my new second chance of life, and I accomplished that. I started off with a calcified cage just shortly after my transplant, and I worked up to running a half marathon, and I did that 14 months after my transplant. Then I started working up to do a full marathon, and I ran my first marathon on my 3-year anniversary of my transplant. But somewhere along the way, I just kind of fell in love with running, and I knew that once I finished that marathon, I wasn't going to stop running. This has now become a part of who I am. So I decided to take the step up a little further, and instead of just run one marathon, I decided I'm going to do something crazy and try to run a marathon in all 50 states and 7 continents with this transplant here. And I'm 12 and a half years post-transplant, and I've already done 38 full marathons in 28 separate states and 2 continents, and I've done 79 half marathons. So I've got 22 more states to do, and another 4 continents to complete to achieve that. So yeah, it's just,
So
I'm just
here's the
grateful that I
positive
can even do
things
that.
coming out of
This
yeah.
guy.
So you know,
Making us look bad.
if anything, I just want to go back to dialysis. Is, you know, kidney failure doesn't mean your life is over.
Yeah.
Peritoneal dialysis is a great way to stay healthy while you're possibly waiting for a transplant. And this all leads to where I'm at right now, and I still feel that I'm healthier today than I was even before I got my transplant. So
Yeah.
It really changed my perspective on my life and on my health. So yeah.
Yeah, I think that for me too, like it's I know, Randy, you had your brother donated, and even though I had a cadaver donation, I was fortunate enough to hear from the mother of the of the donor who transitioned, and I don't know, for me it's just like it just puts a greater emphasis on caring for my body and taking care of this little kidney, for her, like for the mother, because I feel like a sense of responsibility to to do better. Now, I'm not going to run a marathon or anything like that, nor do I. I mean, bravo to you. Like, I'm just always so enamored with that story because, man, I just, I always tried to run and it's just not happening. So, but anyway, yeah, I just wanted to share that aspect, that I think it's just really important that it does kind of change you, to focus more on better. Yeah.
Thank you so much you're such an inspiration, Randy. I love sharing your story. So thank you. Thank you for that. I want to go back to a few more questions for you, Dr. Hebreo. Like, since we're talking about, running marathon, can you exercise while you're doing PD?
Yes, there are certainly no restrictions for patients on PD for exercise. The only caveat or restriction that I would say would be better to not have fluid in the abdomen. If someone was doing a CAPD or doing a manual exchange, that they be drained and then perform exercise. If there's no fluid in the abdomen, doing exercises like weight training, cardio, that can all still be done.
See, that's really interesting. I never heard that when I was on PD, that you can drain and then go do your exercises or other things. That's really interesting to know, because I did have a question that was emailed into us previous about intimacy. Is that something that you can still partake in when you're on PD?
Yes, there certainly is the ability to be intimate with your significant other, your partner. That is not going to be a limiting factor. Just got to be careful about the positioning of the catheter, but if that's taken into account, PD patients can have sexual activity or engage in intimate activity like that.
Yeah, and I think it's just really important to, for couples to really talk about, what they're experiencing. Like, as caregivers, like my husband, he was just so afraid of, like the catheter being pulled out, or, or getting stuck, like, or kneeling on it, or, in
I don't want to
transition
go into all that.
right, or something like that, you know. So it's just so important to really
Right.
communicate that, talk to your doctor, you know, because like it really is not limited, you know, to what we think. You know, we think like, oh my gosh, like I have this thing, you know, that now I can't do anything, and it's just absolutely not true. Like there's just always a way to make it work. Yeah,
So
like
how do you
meaning it.
so how do you even know that it's working, Dr. Hebreo? How do you know that this dialysis is working?
What we generally do for patients after they've been on peritoneal dialysis for a short period of time is we assess what we call the adequacy of the dialysis, and it's a test that we do when the fluid that's drained out of the body is collected, and the fluid is measured for the components of what we're trying to clear out of the body. And if the numbers are being met, that's when we know that somebody is having good dialysis.
You have to weigh that when you're doing your exchange. I think that's right? Once you're finished and you've got what's come out of your tummy, you have to weigh it. It's been a long time for me.
Yeah.
Yeah.
So that specific aspect of it is really just knowing how much fluid has been collected, because that's part of the calculations or the measurements that are part of looking at the adequacy or how well dialysis is being performed. And then as well as how much fluid is actually drained out of the body. I forgot to mention earlier that also what dialysis does is not only clean the body, but remove the extra fluid or water out of our body that we don't need. And that's what is also being looked at and measured.
So we briefly talked about infection because Cindy, that's one of the main things that people talk to you about, right? Their hesitation to choose this modality. What are there other complications or risks to this, or either for Cindy or Dr. Hebreo? I'd like you both actually to talk about that.
Well, I want to talk about something that I get a lot from my patients is, you know, the beginning of PD and the expectations of PD, right? Because there's like no real like little person or little coach every day to say, that's okay, it's okay, it's normal to feel like that, you know, it's going to feel better. So I think it's important to educate expectations of the beginning ramp up period of PD, right? And correct me if I'm wrong, isn't there a little ramp up period where they put in a little bit of fluid and then another little bit of fluid? Because from what I understand, it's not all at once. And there's like a ramp up phase, correct? Where
that is correct. And actually there was a question in the Q&A that I had answered about. Let me just bring it up here specifically about the, you know, how does someone get help and understand the process first? And yes, that does happen. It's a process by which a nurse walks you through and takes you through the steps of how you can become successful doing it on your own. And I think that term you use, ramp up, is certainly appropriate, because you're not going to do it all at once. You're going to just learn how to do it gradually, learn the steps to take care of the catheter,
right,
and then learn how to perform the procedure, and learning how to do it well to avoid infections, learning
right,
how to clean the catheter, how to perform the technique so that we don't introduce infections. And so, yes, that is very important. That happens early on. And as part of the training process, a patient is not going to be doing on their own until we feel comfortable. The nurse who's trained them feels comfortable they can do it on their own. And majority of the time, if not most of the time, that happens for patients.
Thank you.
It is scary in the beginning, but again, you know, you're going to continue to do it and you'll get over that fear.
Yeah, I wanted to add too that that for me it was, you know, there was a couple of months too that my body, like, because it's a huge transition, it's a big change, just dialysis in general, and then if you're switching from in-center to go to PD, it's, you know, you're having this fluid in your body and your body's trying to get like what's going on kind of thing. And so for me, it took a couple of months for it to kind of settle in and, you know, get your routine going, figure out like what works best for you, what doesn't, all that kind of stuff. So just be mindful of that, that it's not like happens overnight, you know, that it takes time.
talk about that, how it's a change of your lifestyle. So what type of quality of life can a person expect when they're on PD versus in-center? And anyone can answer that, because I know all of us, Randy, you also did in-center hemodialysis too. So what do you guys think? Like what type of quality of life did you have on each modality?
Well, when I did hemodialysis, I remember when I first started, it was a struggle. I just struggled to learn how to find the right diet and the right fluid intake. But once I've got that down, I did pretty well. My dialysis sessions were Mondays, Wednesdays, and Fridays at 5 a.m. to 8 a.m. And then I went to work right afterwards. So it didn't stop me from working. But I did notice, obviously, the longer you go without dialysis, the more toxins and fluids build up. So I remember the biggest challenge for me was Sundays. Well, now I've gone a couple of days without dialysis. That was a challenge for me. And then Monday morning, I just remember I just couldn't wait to get there and just clean me out and feel better again. So I appreciated that peritoneal dialysis removed that, because my body was dialyzing, that's the right word, 24/7. So I didn't have those ups and downs and major down on Sundays. So it definitely leveled me out.
Yeah,
Good
that's a great
idea.
way to put it. Yeah,
Mhm.
I experienced the same thing. It was just like up and down constantly. You know, a lot of my struggles, I believe, came from my own non-compliance, especially in the beginning, because I was so resistant to having to start. And so, you know, I didn't want to follow. I didn't want to, you know, do anything that I was being told. And so therefore I became sicker because of that. And so when I finally understood how, you know, all the, you know, phosphorus, it was my nemesis. Like I had so many problems with phosphorus, but the diets were a lot different then too. And so I just think that, you know, like the options are better for people as far as preparing foods and different dialysis friendly foods that are out there. But for me, like the peritoneal, just like with Randy, it was just, I mean, I thrived on PD. And it was just because it allowed me to, because there was less restrictions, it allowed me to give my body what it needed to kind of repair itself. You know, I was still working out, I was still active, working, all this stuff. And so because I was able to drink more fluid, because I was taking it off every day, that just allowed my body to be healthier, I felt. So I think that that's a big part of it.
And, you know, you said you thrived on that. I also, like I said, I used to do my exchanges at work, and I was able to travel too. I traveled like big time. I went to like Rome and Tahiti and a bunch of places like that for work at the time. But, you know, one thing I want to touch base on is, you know, going back to the diet. Dr. Hebreo, why is phosphorus so important?
Yeah, it's a very important topic or area of dialysis patients that comes into play. It is a molecule or substance that can build up in the blood that our kidneys normally get rid of, and patients on dialysis are not able to, or patients who develop kidney disease are not able to get rid of it. And dialysis is certainly helpful to get rid of it, but there are still the need to, you know, restrict phosphorus in the diet in order for it to not build up in the system. And so the reason why it's important is because phosphorus can lead to problems down the road with our bones if it's elevated for a period of time. And so that's the biggest problem we worry about with phosphorus elevation.
And we talked about infection. Well, it's called peritonitis, right? I mean, can you go a little bit into what that's about?
Yeah, so peritonitis is the infection of the fluid, or when the fluid is residing in the abdomen or in that area where the fluid is sitting. And so it's usually a bacterial infection that can take place, and it can show up with abdominal pain, where when the fluid is drained, it can be cloudy. It can also cause a fever, and that infection would need to be treated right away because there are potential complications with peritonitis affecting the area to impact the ability to do peritoneal dialysis long term.
Thank
I
you.
had, to add to that, I had 2 bouts of peritonitis in 4 years. And, you know, it was just so treatable. Like the first one, I just think that what happened was I was new. It happened right after I started. And so I just think that my body's like, what the heck is going on? And so, I knew immediately when I drained, like that's what was happening. You know, it's just like, it's a different whole, I mean, you can tell like it's just not right. And so it was, I know that now it's even easier to treat it now, where before, like I'd take the bag into the ER and, you know, they had to test it and all that kind of stuff. And I understand like now, don't they have like antibiotics that you can actually like have at home to get started on the treatment? Is that,
Wow.
That is correct. Yeah, we are trying to improve how we manage peritonitis because of its impact on patients. And so many times patients, if they feel like they have symptoms of peritonitis, we try to avoid having them go to the ER where they could be treated with antibiotics that they're given ahead of time. Or if they are able to go into the clinic and we could administer antibiotics in a timely manner, and it doesn't require having to go to the emergency room or be hospitalized. We try to manage peritonitis as an outpatient essentially, and are successful a majority of the time.
Yeah,
great.
that's great. That is great, because I don't think that was something you had to go in for that, but that's really good to know. Did you have any issues with that, Randy? Peritonitis?
Yeah, a funny story is my original transplant was supposed to be on October 21st. And I remember the night before I started getting a fever, and I didn't know what it was. And the next morning I had the chills, and they discovered I had peritonitis, so they had to push back my surgery for about another month. Yeah, and that was back in 2009, and I remember I probably didn't know the symptoms early enough, so I didn't catch it in time until it became pretty serious thing. But they treated it pretty quick, and I think within a couple of days I was feeling better.
Is
That's
it,
great.
is it the fluid sometimes when you're draining, is it cloudy? Sometimes is that a sign? I can't remember.
Yeah, cloudy
Yeah.
fluid is a sign of potential peritonitis.
Mhm. And since we're talking about that, what if there's a little blood in that bag? I think we talked about this during our practice time, but what happens then? You shouldn't freak out, right?
Yeah.
What does that mean?
Yeah, so blood could be coming from a number of reasons. A very common reason, especially in women, is that, especially in women that are still menstruating or having their periods, it can precede their. It's a sign that they're having their period occurring. With blood, it certainly could be from other reasons. Obviously, men don't have periods, and if that happens, it's a general situation where it would need to be evaluated and investigated, and generally there can be some serious and some not so serious causes of bleeding, but the most important thing would be to get evaluated and not panic and talk to your nurse and doctor about the problem.
Kind of going back to, somebody
Sorry.
have. Go
Yeah, I
ahead.
just had a question. So, so isn't there like when you're doing your dialysis at home, don't you get like a whole contact list, like a whole procedural, like steps, like you don't have to, like there's a particular person or number that you can call for help so you have support available.
Yes,
I guess yeah.
Very good point, Charmaine. Yeah, there's always an on-call nurse at the dialysis clinic who can be contacted over the phone. They can also call the nephrologist is on call if they need assistance. The other beneficial support that is there is the company that, if they're on a cycler, they can get customer support 24/7 as well to get advice on troubleshooting the cycler. And so there's plenty of resources that a patient can turn to for help.
And isn't it, so I know that too, like when they, just to kind of put this out there for people, that if you are having problems with the cycler, that's why it's important to know how to do the manual. Is that right? So if your cycler like breaks or there is an electrical problem where you lose power, then you can still do your dialysis through the manual procedure.
That's correct. Yeah.
And you don't need to have a separate catheter or anything. You can still do it up from the same catheter that you have placed.
Yeah.
Mhm.
Right.
Yep.
We had a couple of emails earlier about can you take a bath? Can you swim?
Very good questions. Yes, you can, as long as after the swimming, if you're in a pool, whether or the ocean, making sure that the care that you're taught to do is done, because then we don't want that catheter to get infected. And as long as the catheter is cared for, activities like swimming, being in a pool, a hot tub. Hot tubs been controversial in nephrology circles, but again, I think most would agree if it's a situation where the catheter afterwards is cared for, then the chances of any complications or problems like an infection are lessened.
Oh,
So has that changed then, Dr. Hebreo? Is it, because I remember many years ago that that we couldn't swim, we couldn't take a bath, right, Kiku? Was that the same for you too, and
yeah.
Randy?
Yeah,
Yeah, and then you couldn't swim.
definitely not the hot tub.
Yeah, no, not the hot tub. I don't even go in the hot tub now. But anyway,
yeah. For
but-
me,
yeah.
Charmaine.
No, I was just gonna say, like, you know, like you could go into a pool, but not like a community pool. Like if
Correct.
you could swim in like a private pool, you could go into the ocean, but not necessarily a river. So like stagnant, I guess stagnant water,
Yeah.
you should have avoided. So has that changed?
I think you know, it's still recommended that those activities be avoided to lessen the chances of infection. But if it happens to be done, and you know, for some people, they just enjoy going in a pool and you know, maybe that's their activity for exercise. There are things that we can do to lessen the risk. And so I think the risk is still there, but if someone really wants to enjoy it, then and be part of that activity, I try to make sure that the patients are taught how to care for them if they're going to be engaging in that activity. Going back to the hot tub, you know, the only other scenario to keep in mind when we were dealing with hot tub is not only the water, but the temperature, you know, whether or not that could affect the catheter. So yeah, there is that theoretical risk that we have to worry about. And so having said that I was involved in a recent forum online where I read about it, and you know, there was, you know, back and forth, you know, whether or not that could be done or not. And I think if it's an activity that's done infrequently, or maybe it was a one-time thing, again, as long as the catheter is cared for, then that might be okay. But on a regular basis, maybe that's something where a patient may need to be careful about it and maybe avoid doing that just to avoid complications.
Good to know. You know what? I forgot to mention, I wanted you to mention, Dr. Hebreo, that you're also, what are some of the other things that you do? You are also the medical director for DaVita? What?
Yes. So right now I'm a medical director for 2 home clinics in DaVita in North County of San Diego, DaVita Oceanside, and then DaVita Hidden Valley, which is in Escondido.
Well, see, people, we get good folks on here with, I'm just so happy that we're able to have you here today. So thank you again. Kind of going back to the phosphorus, but not really. Why is protein intake also something you need to watch? Is that true?
Yeah, so we in general, we worry about protein malnutrition in dialysis patients. And that's even more so in peritoneal dialysis, because there is the thought that we do get some protein losses with the dialysis procedure itself. And so having more protein intake is recommended for patients that are on PD, just to make sure that we don't have or develop, you know, protein malnutrition.
Okay, thank you for that. And, you know, I wanted to share some information, some kidney education resources for people, and we can keep on chatting about stuff right now. We have a few more minutes, but some resources that people may not be aware of. You know, American Association of Kidney Patients, the AAKP, is a pretty awesome website, amazing organization. They have patient education and engagement through community events. They have a program that's called Kidney Works. I'm not sure all the details about it, but it helps people that are on dialysis, helps them keeping and getting back to work. The National Institute of Diabetes and Digestive and Kidney Diseases, really long title, but hey, they do some solid work. They have information on CKD, chronic kidney disease, and health tips. They've got this cool 1 minute, it's a living and healthy lifestyle. I don't know if it's a podcast or how that works, but they have cover multiple topics on kidney disease. And of course, the American Kidney Fund, an amazing organization, kidneyfund.org, information about kidney education, kidney disease, risk factors, prevention, facts, stats, patient assistance. They actually have grants and help with insurance premiums. So check those out. Well, as we get closer to the time, I wanted to ask you, all of you, our wonderful panelists, what would you like our viewers today to take away from our discussion? Let's start with Randy.
Well, I would say for me, when I got diagnosed with kidney failure and I had to do dialysis, I went into this knowing that, you know, you could look at this, you could look at the negative side of this, but the truth is that it's just keeping you alive. So my focus was to really listen to the dietitians and try to understand how my diet and my fluid intake is affecting my health and how I can do better. So my tip to any patient is just really listen to, especially the doctors or the dietitian when they're reviewing your blood work, because that really is key to maintaining a healthy lifestyle while you're on dialysis. And you know, just following the simple steps can really go a long way. And of course, I've also, you know, mentioned that, you know, peritoneal dialysis took that to another level and really helped me live a normal life to the best possible way while on dialysis. So yeah, I got that.
Yeah. Thank you. Ramin, how about you?
Well, I guess the big takeaway is that you know, for those who are already on dialysis or getting ready to start, to just, you know, look at PD as an option, you know, look at home therapies as an option. You know, reach out to ReMend, because we're here to talk about our experiences as well in greater detail, you know. And ReMend Mentors, we're all free, so you just give us a call. But for the most part, I just think that you know, just to educate yourself on the options that are out there. And I think Cindy and Dr. Hebreo can confirm this, but if you are on PD and it doesn't work for you, you can then go back to in-center. Is that correct? So you can change your modalities as well. So you're not locked into anything. So yeah, just give it a try and continue to educate yourself.
Cindy, can you share what you'd like people to take away from our conversation?
You say my name?
Yep.
Yeah.
Cindy.
You know, I think the more you know, the more it'll flow, right? So you can kind of just set those
Look at my girl.
expectations, right? So educate, advocate for yourself.
Yeah.
And, you know, and just like what Randy's saying, yeah, this sucks, right? It sucks.
Yeah.
But
Yep.
it is what it is. And guess what? You have options to live.
Yes.
And not just an option in center, but you have an option at home now. So I think we just need to really promote peritoneal dialysis, and folks like you is just so critical, because you guys are the inside connection for the outside world, right?
Mm-hmm.
So I think it's just really important that we have ReMend and we have people like you that coming up and speaking the truth and speaking their experiences, because, you know, as a healthcare provider, we know what we know, but the inside scoop is really the good stuff. And that's the stuff that patients want to hear. They want to know the truth. And I think by you guys being here and sharing your story, that's pivotal for this time, and especially for home therapies. And I think, you know, PD, you talk to a nephrologist or any physician or anybody in healthcare and you ask them what would be their choice, PD, home therapies. Absolutely. Just give that ramp up time.
Yep.
Right.
Yeah.
So
Good reminder.
thank you. Yep.
Thank you so much for always being here.
Of course.
Dr. Hebreo, how about you? What are some of the things you'd like people to know from our conversation?
Yeah, first of all, I want to say thank you to Randy and Charmaine for sharing their experiences, because it's certainly what I've seen in my patients. And what I'd like you know, those to take away from tonight is really realizing that, you know, dialysis is a big part of your life when you develop kidney disease and kidney failure. But one of the things that I've learned and seen with peritoneal dialysis is that allows you to, take charge of your life and to learn how to live your life where dialysis doesn't necessarily need to dictate what you are needing to do. And I think you can live with dialysis when you're on PD, a little bit more effectively and allowing you to be able to do the things that you would like to do in life. And one of the things that I've learned in the time that I've been doing this is peritoneal dialysis is something where you can actually try to tailor it as best as possible for the patient. You have manual versus cycled dialysis. And so I have patients go between the two. Mostly patients do decide to do the cycler, but I think that that's one of the advantages of peritoneal dialysis is being able to tailor it to you. And one thing that I didn't mention is a recent push is this idea of what we call incremental peritoneal dialysis, where when we started in a way that fits your lifestyle. It fits how it works for you, where you may not need to do it every day because you still have a good amount of residual kidney function, where you are maybe just doing a few exchanges and not having to do the standard treatment. And so I think that that's one of the advantages that a lot of nephrologists are starting to do now. And it's a really big push for us as far as how we can make dialysis really work well, especially early on with how rocky starting dialysis can be, and trying to make it as smooth and as helpful as possible for the patient in that transition. And so I'm a very big proponent of PD and try to get my patients on them if they like. And I think the point that Charmaine made is that, you can always try, but if it doesn't work for you, there's the other option of going on to hemodialysis. And so I think the most important thing is that a patient who has kidney disease does have options. And I couldn't have said it better. Cindy's words are well spoken as far as educating, because if you educate yourself, an educated patient is going to know what they're getting into, and it's going to break down any barriers or any fears that you may have. And always ask. And that's the last thing I will say is just, you have resources. I'm glad that we have a program like ReMend where, patients who have walked the walk before and talk the talk, you can certainly share those experiences and learn from them. And, ask your questions to your doctor, ask it to your nurses, because that's the most important thing to try to educate you to live as successfully and as healthy as you can with kidney disease.
Awesome. I loved hearing all of that. Thank you for that. That was pretty awesome. I didn't know that incremental.
I know,
That's
yay.
really exciting for patients, I think. So thank you for sharing that. Yeah. So I just want to say, we know this information can be overwhelming, but, we really hope it encourages you to focus on your self-care and become your own advocate. Ask questions, as Dr. Hebreo was saying, ask questions at your doctor appointments, bring somebody with you, record your visits on your phone, keep notes. I still do that. So if you or someone that is dealing with kidney disease and would like to speak to someone who's been on their own kidney journey, walk the walk, please reach out to us. Please reach out to ReMend, remend.org. You can, be involved by donating, or you can become a mentor or check out previous broadcasts. When we have broadcasts, we ask patients to send in, we ask people to send in the topics that they would like to discuss. So we would love to hear from you. That's remend.org. Kidney disease isn't a single person disease either. It really involves your whole family, changes your life. So, education is key. There are millions of people in the United States who are affected by kidney disease, and it's important to know that you're not alone. So next month, we've got another one of these lovely webinars, and we hope that you will be able to join us. It's next month is National Mental Health Awareness Month. And so we're going to talk about mental health and kidney disease. I don't have a fancy title for it yet, but we're working on that for people. And that'll be on Thursday, May 19th. So mark your calendars, 5:30 to 6:30, same time that we have for this one. And anybody have anything else they'd like to share? No? Okay. Well, thank you so much, everyone. And thank you for watching. You can contact us on remend.org. We have a new phone number. It's 858-810-7437, 858-810-7437. We are on Facebook, we're on Instagram, and a YouTube channel. It has most of our previous broadcasts. And reach out, email me at info@sdremend.com. So thank you, everyone. Thank you, panelists. I really appreciate it. Thank you so much. Peace out, everyone. Take care of yourselves. I'm out.